Hi everybody, today we're going to be talking about panel identification in MedAccess, just the basic demographic information that you need for this. If you look at the main screen, you will see that there's a search button. From here, we will go in and search for a patient, search for their demographic information. So there's many ways that you can do this. You can search a patient by last name, first name, chart number, institution number, phone number, and date of birth if you know any. In this case, I'm just going to be using a test patient. And once I search for that patient, you may have a lot of them. In this case, I'm just going to be using a test Alexander, and you notice that if I hover over, a little bit of the details of the patient will come up just to make sure you're picking the right one. If you're sure that this is the right patient, you click on it, their chart will open up. There'll be a lot of tabs. We want to make sure you want to go to demographic tab, and under demographic tab you want to make sure you have all the right information: last name, first name, date of birth, primary identifier number, which in this case would be your personal health number. You want to make sure you know the gender of the patient's status, which we'll talk about later. Make sure you update the address of the patient, and that confirms the city, province, postal code. Also, the phone number is a very important measure that you need to have here. You can change this to have a home phone number, a work number, personal number, and even an emergency contact. You also want to make sure you attach a patient to a primary care provider, whether that's a name or a clinic. You can hover over here and pick any doctor that you would like. And once you have done this, you want to make sure you update the record. So you notice that if you hover over, it will let you know when the last update was by the person and the date and time. It date stamps it. You click on that button, it will date stamp it again, and that will confirm that all of the information that you have here has been updated or and confirmed.